Did your doctor tell you that one or both of your kidneys are swollen and your kidneys are slowly starting to fail, and now you are experiencing pain over your loin region or your lower back? And if so, then this video might be for you. Hi, I am Dr. Diwakar Manandhar, a licensed kidney specialist working in Nepal, and today one of our friends from TikTok has asked us a question saying that one of our kidneys is swollen for 3 to 4 years and it has not returned to its normal size. So today in this video we are going to talk about that. Before starting this video, I would appreciate it if you would like and share this video, and if you would subscribe to this channel. Now let's get into it. Urinary tract obstruction is a condition where the flow of urine is obstructed anywhere in the urinary tract system. It can be acute, which occurs within weeks, or it can be chronic, which has persisted for months and even years. It can be partial, where the urine has some pathway for its flow along the obstruction, or it can be complete, where the urine cannot pass at all. It may be unilateral, where it is involving only one kidney, or it may be bilateral, if it involves both the kidneys. And if by any means, if there is rising creatinine or you have impairment in your renal function, it is promptly reversible if the condition is corrected within 7 to 10 days. And if the condition has lasted for more than 10 days, the swollen kidney tends to remain swollen and there might be some permanent damage occurring in that kidney. The incidence of urinary tract infection causing AKI is unknown. In a survey-based study involving more than 2 million hospitals in China, it has shown that urinary tract obstruction is a cause of AKI in about 12% of the patients. And in another study, among 381 older critically ill adults, urinary tract obstruction was a cause of AKI in about 22% of the population. Now, before entering into our main topic, let's talk about the anatomical structures of the urinary tract system. It consists of two bean-shaped kidneys located in the posterior wall of the body of the abdomen, from where ureters or pipes coming from the kidney passes inferiorly to the kidney, passes along the posterior abdominal wall in the retroperitoneum. It goes down along the posterior surface of the urinary bladder and it gets inserted in the bladder, from where a urethra, a second pipe, comes out from the neck of the bladder, from where urine gets passed out. Now, urinary tract obstruction can occur anywhere in the urinary tract system. It might occur in the kidneys, it might occur in the ureter, it might occur in the bladder or in the urethra. If the obstruction occurs within the kidney, the potential causes are 1. Stone, 2. Any prior infections or surgery, 3. Any blood clots, 4. Cancer, and 5. Sloughed renal papillae. This condition can cause dilatation of the calyces, and it doesn't involve the ureter or the pipes. And if the obstruction are present within the ureter, the pipes, the potential causes might be 1. Renal stone, 2. Cancers, 3. Retroperitoneal fibrosis, or 4. Any aberrant vessels or external compressions, that external structures that are compressing the ureter, leading to swelling of the ureter, which is called hydroureter, and the swelling of kidney, which is called hydronephrosis. Now think of our kidney as a rubber balloon with openings at both the end, and we connect one end to the tap and we open the tap. So after opening the tap, water gushes out from the pipe through the opening. Now if we obstruct the outlet of the rubber tube, then what happens is that the water pressure within the pipe causes distension of the rubber tube. Similarly, if there is any obstruction present in the urinary tract system in the pipes, then what happens is there is distension of the pipe and also distension of the kidneys. Now, if the obstruction is present in one kidney and in that corresponding ureter, then there is swelling in only one kidney. The other kidney remains normal. The potential causes might be stone in the urinary bladder, or cancer or malignancy obstructing both the ureters, or a neurogenic condition where the urinary bladder is controlled by the nervous system, because of which the bladder can contract and expel the urine out of the body. If by any means there is problem in the nerves controlling the bladder, then the bladder cannot contract and expel the urine. So there will be increased pressure within the bladder, causing back pressure to the ureter and the kidneys, leading to swelling of the ureter and kidneys. Now, talking about the symptoms, a vast majority of the patient who has got urinary tract obstruction other than due to stone remain asymptomatic. However, infrequently the patient might present with hematuria, that is blood in the urine, urinary urgency or change in the urinary output, and the patient might also present sometimes with pain. Having said that, pain is a symptom that is frequently absent even in case of acute obstructions. But the pain can occur due to renal stone that is obstructing the pathways. But in some condition, if there is acute retention of urine in the urinary bladder, then the patient can experience a sharp pain that is located in the lower abdomen. Now, talking about the urinary output, it can be quite variable, ranging from anuria, that is hardly passing any urine, to oliguria, where the patient can pass a small amount of urine, to passing normal urine, and in some cases even polyuria, that is passing urine in excess of more than 3 liters per day. Now, when do you suspect if the patient has got urinary tract obstruction? We can suspect the patient to have urinary tract obstruction if the patient has got any prior history of prostate involvement, which includes benign prostate enlargement or prostatic carcinoma. Number 2, if the patient has got any prior history of surgery that has occurred in the urinary tract system. Number 3, if there is any suspicion of abdominal or retroperitoneal malignancy or cancer, or if there is presence of any renal stone or history of renal stone, or the patient is passing profuse amount of blood in his urine, or if the patient has got prior history of abdominal or pelvic surgery, and if the patient is suffering from neurological disorders involving the bladder. Now, how do we investigate this condition? So, number 1 we do is a renal function test, which shows us whether the patient's creatinine is gradually increasing or it is static to a normal level. So, if the creatinine is increasing, then we get an idea that the patient's kidney is starting to fail. It might be due to obstruction in both the kidneys, or obstruction in a single functional kidney, or if there is obstruction present in the kidneys with that kidney having a history of prior injury. Number 2, we can go for a simple urine analysis which shows multiple red blood cell or white blood cell that has been passed in the urine. Number 3, we can go for a radiological examination which involves ultrasound and a CT scan, which can give us an idea about the enlargement of the kidney and its cause. Now let us talk about the prognosis of this disease. So the prognosis depends upon the severity and the duration of obstruction. If the obstruction has occurred within weeks, and if we promptly remedy that condition, then the swelling or hydronephrosis slowly starts to regress and comes to its normal size. But if the obstruction has lasted for more than 7 to 10 days, there might be persistent renal damage that has occurred in that kidney. And even after that, the obstruction has not been relieved, then the kidney can progress to severe renal failure, which might even need dialysis. The degree of recovery from urinary tract obstruction also depends upon if there is any history of pre-existing kidney disease, or if the patient has got hypertension, or if during the period of urinary tract obstruction there is an infection. So with this condition in play, the recovery might be delayed. Now, how do we treat this condition? As explained prior, there are a lot of conditions that can cause swelling of the kidneys. So treatment is specific to that condition. For example, if the swelling is caused by a renal stone, then we can go for a medical expulsive therapy where without surgery, where we can try to pass that stone in the urine. But if the size of stone is large, then probably a surgery might be needed. Number 2, if the patient has got benign prostate enlargement or prostatic hypertrophy, then we can prescribe the patients with some medications which can open up the pathway for the passage of urine, and some medication can cause shrinkage in the prostate size, which can lead to improvement in the symptoms. But despite in some patients receiving those medications, the symptoms persist, then a surgery called TURP can be performed. If the condition is due to malignancy, then proper evaluation must be done to see whether any chemotherapy or radiotherapy is needed in this patient, or any palliative surgery should be done in that patient. So treatment is very variable. So with this video, you have gained some knowledge about hydronephrosis. And if you have any questions, you can please post it in the comment section. And if you like this video, do not forget to like and share this video and subscribe to this channel. Thank you for watching. Until next time, see you.